Hello, my name is Dr. Rodriguez Torres. I'm a board-certified internal medicine physician who holds multiple state medical licenses, including in Puerto Rico, where we're going to be focusing our discussion today. Regarding the latter, I want to shed some light about the ongoing collapse of the Puerto Rican healthcare system, which is extremely worrisome, and which is why we're providing this message to you today. To give you an example of how this collapse is already ravaging our critical infrastructure, we can see as recent as this past Friday how one of the main children's hospitals in the island, the San Jorge Children's Hospital, had to file for bankruptcy, which, according to the chief executive of the hospital, is due to multiple reasons, including the difficulties faced during the COVID-19 pandemic. But as we all know, the problem is more chronic and deeply rooted. And to speak about that, we must address, without any doubt, the elephant in the room, and that is how private health insurance companies are operating in the island, which is concerning specifically for a lack of oversight and proper auditing by the pertinent state and federal agencies. It is extremely concerning that while private health insurance companies operating in Puerto Rico are reporting record-making profits, our critical infrastructure, including our main hospitals, are failing. Our healthcare personnel, including doctors, nurses, respiratory therapists, and many others, are fleeing the island in search for better payments, better quality of life. And this is all has to do with the poor and limited and significant underpayments provided by health insurance companies, where on a regular basis they pay much less than what they should according to the Medicare fee schedule in the running year. Also, and specifically, there's a concern regarding, as I previously mentioned, a lack of oversight and audit, specifically in terms of statewide agencies. We must make responsible the Puerto Rico Health Insurance Administration and the Office of the Insurance Commissioner, which have a direct role into providing proper oversight and ensuring that taxpayer money is used where it should, on the medical care of patients and in the payments for providers on the front lines taking care. We make an urgent call to the Center for Medicaid and Medicare Services and to the Office of the Inspector General of the Department of Health and Human Services to take a close look into how health insurance companies are operating and using taxpayer money, to make sure that the money that is intended to go towards the care of patients and for the payments of providers are reaching their final destination as they should. And I invite them to do so in a swiftly manner before more critical infrastructure is placed in a difficult position that could lead to a complete and total collapse of our healthcare system. To the Governor of Puerto Rico, I invite you to consider calling and declaring a state of emergency to address the collapse of the Puerto Rico healthcare system. If we don't address this now, later it will be too late, and the lives of many will be put in jeopardy because of the inactions that were considered and taken today.